Hello, it's me, Julio, and today we are going to be talking about image-guided joint injections. The human body is supported by a frame structure called the skeletal system, and this frame is made up of bones. These bones are interconnected via bony junctions called joints, which are then wrapped around various soft tissue structures such as cartilage and ligaments. Now, image-guided joint injections is when you take an imaging modality, such as general radiography, or for the most part, fluoroscopy, to help guide a wire needle into the joint space. Some common joint spaces where image-guided joint injections are done are some major weight-bearing joint areas such as the hip, shoulder, and knees. Now, there are three things that can be done with image-guided joint injections. The first procedure that we will be discussing about that utilizes image-guided joint injections is arthrogram. Now, what is an arthrogram? An arthrogram is when we utilize image-guided joint injections to introduce contrast media directly into the weight-bearing joints. This contrast media varies whether we are using CT or MRI to follow through on the arthrogram. For MRI, we use gadolinium as our contrast media, while for CT, we use omnipaque as a general contrast media for these types of procedures. This procedure is performed by a qualified radiologist and is assisted by a qualified radiological technologist. The next use for image-guided joint injections is when we need to inject hydrocortisone directly into the joint space. Now, why would we need to inject hydrocortisone directly into the joint space? For patients with major arthritic changes in the joint spaces, they are in a lot of pain, and sometimes a typical analgesic may not work anymore. Therefore, their family physician can recommend hydrocortisone steroid injections directly in the joint space to alleviate the pain. Hydrocortisone injections should only be done if regular analgesics are not working anymore. And hydrocortisone is useful because it's a very powerful drug that helps alleviate the pain. And the third and final reason as to why we may need to use image-guided joint injections is for specimen collection for diagnosing any infection at the joint spaces. Like any other kind of medical procedure, joint injections pose some contraindications for certain types of patients. Such contraindications may include sympathetic dystrophy syndrome, which is a condition wherein any aspiration done in the body causes extreme pain in the limbs of patients that have experienced stroke before. Any allergies to medication that we may be introducing, such as lidocaine, hydrocortisone, or the contrast media itself. Patients with history of infection that are at high risk of further infection when we aspirate the body. We also need to keep in mind patients who are pregnant because we are using radiation for this procedure. Coagulopathy, because we are literally penetrating through the joint space and making a wound. Therefore, if your blood doesn't clot properly, that is contraindicative. Now that we have talked everything from indications, contraindications, and the types of things that we do in image-guided joint injections, so now let's talk about what exactly do we need to perform these types of procedures. Well, the first thing we will need is a sterile tray that contains some sterile drapes, some sterile towels, some sterile syringes, and some sterile containers for containing anything that we will need for the procedures. We will also need some sterile gloves we will need a biopsy needle that is sharp enough to penetrate through the weight-bearing joints that we are imaging for this procedure. The next thing we'll need is a stopcock to control the flow of fluid and gas into the joint. The next thing we'll need are some needles for drawing up medications and introducing medications into the joint. some lower lock syringes for containing the medications that we need to draw up, some skin prep solution for sterilizing the skin area, gadolinium for our MRI contrast, Omnipic as our CT contrast media, lidocaine for our local anesthetic, and finally some hydrocortisone medication for our arthritic joints. Here are the personnel involved for the procedure. In the following video, Dr. Paul Latimer is about to explain the procedures and steps in fluoroscopic guided hip injection.
We prepare the skin, so we use a cleaning solution to actually sterilize the skin as best as possible.
Your leg, is that okay? So it's always colder than we might think.
We then introduce some local anesthetic in the skin.
Do you feel anything at all? Let me know. A little bit stingy. Let me know when it starts to go off a bit. So we're using a local anesthetic to numb the skin on the outside, and then we're going to let that work for a few moments before we introduce the needle.
So in order to perform a hip joint injection, we want to get the needle right into the actual joint itself, and we want to prove that it's in the hip joint.
So I'm just popping the needle in, and we're going to watch where it goes on the X-ray. Flash there, please. We're using the X-ray machine to identify exactly where the hip joint is. Well done, you. Flash there. Good. You're doing very well. Flash there. And there. Good. Well done, Jean. You're doing really well. And flash there.
But we also want to prove that it's definitely in the joint, and in order to do that we inject a contrast medium to ensure that we're in the right place, and that can be something as simple as air, or it can be a contrast drug that we inject.
So now, Jean, I'm going to inject a little bit of air just so that we can prove we're in the hip joint. Flash there, please. Lovely. Save me a copy of that, please.
We can physically see the inside shape of the joint that identifies positively that we're in the hip joint.
So the two drugs we're using are a long-acting local anaesthetic and 40 milligrams of Kenalog, which is a steroid.
Steroid reduces inflammation within the hip joint and therefore offers more long-term pain relief by reducing that inflammation. Once we've injected the therapeutic substance into the hip, then we simply remove the needle and place on a little dressing.
Good, well done. And I'm on my way out, okay? Well done, you did really well. I'm popping a little sticky dressing on there.
So after the surgery, we let the patient come back to the waiting area, and after 5 or 10 minutes, when the local anaesthetic has worked, we want to reassess their pain and ask them specifically about their pain, how it was before and how it is now. If there's no pain after the hip injection, that means that the hip joint itself is the source of that particular patient's pain. If the patient still has all of their pain, then we can infer that the pain must be coming from somewhere else, and therefore we need to look elsewhere for the source of that pain.
Wonderful.
I feel a hip joint injection is a really beneficial thing for patients. Not only do you have the diagnostic benefit, you also have the therapeutic benefit, and it offers a low risk strategy for managing some long-term conditions.
When it comes to pre-procedural care, there aren't much things to keep in mind when performing image-guided joint injections. Patients may eat and drink as they want before the procedure, but it may be good to advise them to refrain from eating 2 hours prior to the procedure just for comfort reasons. When it comes to arthrogram, we also need to keep in mind that when booking patients, we want to book the joint injection within 2 hours before they have to go to CT or MRI, depending on what type of imaging modality the radiologist or the family physician requests for the joint study. Now, let's discuss some possible complications that may occur after image-guided joint injection procedures. Some patients may experience allergic reactions since we are introducing contrast media or medications into the joint space. Since we are aspirating the joint space, we also need to advise our patients to keep track of any signs and symptoms of infection at the site. Some things that need to watch for include redness at the site or possible swelling at the joint space. We also need to advise them to avoid any weight-bearing movements for a few days, 24 to 48 hours, because for injection procedures at the hip, it may be too painful for them for up to 24 hours or even 48 hours. Okay, and that concludes our video on image-guided joint injections. If you have any questions, Julio, that's me, will be sitting in front or at the back depending on where I am. Joyce Lou. Anyways, thank you for watching the video. Bonnie, thank you so much for accommodating for everything that I need, for the equipment, for the room.
Loving the cold, smoking rolls, see your fingers shake, and getting through your heartbreak. Some kind of free, same for me, don't know